There's been a lot of back and forth, obviously, on the House side and the Senate side about what to do to change Obamacare. My understanding of it, I really want, Andy, and I really want your view on this, is they're trying to do two things. One is save some money, and the other is fix some of the exchange problems because some of the insurance companies really are pulling out of them. Are they moving toward that goal?
Let's look at they're generally speaking two, I think, valid goals in health reform, major health reform legislation like this. On the one hand, you want to cover more people, and that's something that generally Democrats and even centrist Republicans would have as a noble goal. And on the other hand, you want to reduce costs. You want to reduce premiums, and I think the president has talked a lot about reducing premiums. The challenge with this bill is it does neither of those things. It increases the number of uninsured by 22 million on the one hand, and on the other hand, it increases the cost of a policy, apples to apples, by 74%. It essentially makes everything more expensive. So it's not a surprise that there's a lot of unhappiness when the senators went back to their districts in 4th of July. And I think the amendments that we've seen what's coming out today doesn't really change anything. Those things are still true. We're still seeing massive amount of coverage loss, and we're still seeing prices driven up, and we're seeing consumer protections erode. So they're in a bit of a spot.
Well, Andy, let's focus on one specific thing that we expect to see, which is a couple of the taxes that had been put in by Obamacare and they were taking away, they're going to leave in. So they're going to have more money coming in because of some of the taxes remaining on the books. And reportedly, that's going to help them with some of the Medicaid issues, where otherwise it would cut people back. Wouldn't that at least move toward a better goal?
Well, so let's take a look at that. The analysis that I've seen shows that the cuts that they're considering keeping in would keep about 20% of the money in. So they're still cutting 80%. And then the question becomes, okay, well, what are they doing with that funds? Are they going to do that? Are they going to help healthcare become more expensive? And unfortunately, it looks like what they're doing is they're going to take it and create another tax cut, a tax cut for high-income earners who invest in health savings accounts, and then spend some money on a kind of a slush fund that they plan to use. Unclear how they plan to use, but an unnamed slush fund for Trump to spend. It doesn't look like the money is going to either improve subsidies or go to Medicaid. And so this morning, senators from states that have Medicaid, which is every senator, but particularly Medicaid expansion, are pretty unhappy because it looks like their needs aren't being met with that potential cut.